Another course on workforce planning. This is course D, which is WRaPT Hub, and what we're talking about here are the development pretty much of ICS, so Integrated Care System, or STP, Sustainability and Transformation Partnership, basically health and social care hubs and collaboratives. So we're talking about how do STPs and ICSs ensure that workforce planning in its broadest possible sense is happening across the whole of their health and care system, and that's what we're going to be covering today. I'm Colin Nuri. I run Carados. We're a management training and development company. We focus on building skills and developing people in frontline health and care managers. We develop them in workforce planning, cost control, customer service, and general management skills. Workforce planning, though, runs through the heart of what we do, and as it says at the bottom there, we also work with Lancashire and South Cumbria to deliver the WRaPT tool funded by Health Education England. That WRaPT team maintain a free-to-use online secure workforce modelling tool, which is WRaPT, and they also train in its use and provide free tools and techniques. The way we do that is that we provide those free tools and techniques like the WRaPT tool, like this training, like even, it's not exactly free, but it's pretty blooming cheap, the bumper book of workforce planning, which is a written down guide to all of this stuff and companions this course. We provide that, but it's not enough. You need to provide the capacity yourself to undertake this work, and more so than ever for the WRaPT Hub is you need to make sure you've got the support of your boss and the rest of the system to be able to do this if you're going to make it happen. So you need to make sure you've got the infrastructure and support, and you need to actually run through a project to deliver this stuff to make it realistic. So if you're thinking of putting in place a workforce hub or collaborative, or just want a different view on what you've done, then this is probably the course for you, but you need to actually implement it if you're going to develop yourself. It's no good just rattling through what could be 45 minutes of me flicking up various blue diagrams. This module fits within the overall workforce planning theme. We've talked about what workforce planning is. In course B, we talked about how to redesign workforce, and that was the big one. There was a course on how to develop a workforce plan. Pretty soon, how to use a free workforce modelling tool, WRaPT, will be up. And we've still got frontline workforce planning to go, which is the scheduling and rostering type frontline stuff that you might need to pick up. This one, we're going to cover what is in a hub team, what the hub roles are, and so basically what should a hub do. And then we're going to cover SWIM, which is the System Workforce Improvement Model, which was developed or has been developed by NHS E&I and has yet to be launched on the world in a big style, but is something which will be quite useful for you to know about and is quite interesting. But we'll start with a bit of an overview. Before we get into that, though, just be aware that we have taken you through the WRaPT redesign approach in course B, which was basically around how do you redesign your workforce. But you can also use its basic underlying approach to implement a project like this, any project really, scoping and mobilising and doing the things that are mentioned there around developing the challenge, engaging the stakeholders, etc., making sure you've got IG in place. All of that stuff is relevant. Then moving into understanding where you currently are, as in what's already in place and who have you already got, developing a future state, absolutely critical to engage people in pulling together a workforce hub. Modelling it, at least costing it, and then implementing it are going to be important. So if you don't have an approach to doing it, then it's worth flicking through that course to make sure you've got a general approach to be able to put in place a hub. And I'm not going to go through that in a lot of detail, or at all in fact. What I'm going to go through is what a hub is and what the elements of a hub are in terms of what others have done. So what is a hub? Well, there's lots of different words for it, and I've heard quite a few. So these are the ones on the right I have heard. So workforce hub, a workforce collaborative, which is a good one. I like that one. A workforce development hub. That's nice because we're developing the workforce. Workforce planning and development hub. I like that one because we're doing workforce planning and we're developing people. The Centre for Workforce Innovation. I like that one as well because you've got a very different view on things. I haven't heard any yet with people in, but I'm sure we will get them. So People Hub or People Collaborative or whatever else. I'm sure we're going to have lots of different names for this stuff. But basically what this is, as I said right at the start, is if you are running an STP or an ICS, this is the mechanism by which you make sure that you have system workforce planning. And that's in its broader sense about making sure you have the right people with the right skills, behaviours and attitudes in the right place at the right time. So it's not just about numbers, it's about how do you bring people in to create the workforce plan, the workforce of the future really, and to maintain that workforce in what is a complex set of organisations and potentially multiple ICPs, multiple organisations working within it. And that's what we're going to go through today, is we're going to cover those different elements of it. So I think the most important thing is you've got to have some people in it. If you haven't heard my my theory on we need more teeth, then refer to some of the other courses or watch the film Jurassic World. But the key aim here is to make sure that you have got people helping you with this, okay, and delivering this. The more people you've got, the more resources you've got targeted at this, the more stuff you're going to be able to get done in a world where basically you could have almost limitless resources and still struggle to deliver what is a massive agenda. So who's the team? Well, I'm going to talk a bit first of all about some of the team around the edges, and then I'll get into the sort of the detailed team. But basically you're going to need an executive lead for workforce. I mean, that's I think it's pretty much a given that you're going to need one of those for your ICS or STP. And they're the ones that sort of set the ambition for the program. They're the ones that are driving the sort of whole culture of how the workforce strategy is developed and it's delivered. They need to make sure it's linked in with the wider system. They protect the program from just spurious requests for workforce information, but they also push back up and make sure that you're getting the resources that you need. And they chair the people or workforce board for the system, which is what this blue box is a sort of a workforce board box for some reason. I haven't put any tags on it. So the executive lead, likely to be an HR director of some sort, but don't have to be, who will be the executive lead for the workforce. And that, they will lead the people board, and that people board will link into the system board, and it may link into some sort of regional people board as well, but there'll be dotted lines, so report into the system workforce board. That group, and we'll go into more detail later on, will include ICP or organisation reps. So it'll be ICP reps if you've got multiple ICPs. If you don't, then it'll be organisation reps, and there'll be other reps which we'll talk about within the governance arena. What you will also have, and that should say system workforce lead there, I haven't copied that across properly, is you will have a system workforce lead. I'll leave it on this diagram because it's got the right word on it. Now that system workforce lead, what you're realistically going to need, unless you're absolutely tiny, there's no way the executive lead is going to do anything. I mean, the executive lead is accountable for workforce, but they will have a system workforce lead who will make sure that this is being delivered. So the responsibility and the actions will fall to that system workforce lead. It might be part-time, but realistically that should be a full-time lead. There's a lot of work to do. So your system workforce lead will need to be running the whole thing. So hopefully you've got one of those. Quite possibly it's you listening to this. Now you will need some people in your team. So you will need a program management office. It's one of the things we'll talk about. But what you're going to need is a person, a team, part of a person, doesn't matter who it is, whose basically whose job will be to monitor progress and much more than that, which we'll talk about PMO as one of the actions in a bit. You are also going to need an administration function of some sort. So you're going to need an administrator who can help arrange the sort of complex administrative world of the hub, including arranging the people board, etc. So you're going to need those. But you're also going to need some doers. Now, that is a bit of a problematic term because lots of people do things, but you are going to need some people who can help you to do stuff, because even as the system workforce lead, you're going to get dragged into a lot of meetings, and if you don't have people that can cover aspects of your responsibility, then you are going to struggle. Okay, so you are going to need some people there to help you with that, either in-house preferably, or some bought-in support, you are going to need some doers. What you're also going to need is you're going to need some, you're going to get help from other stakeholders. Okay, so there can be various other stakeholders who will still want to be involved, and you might also have some close collaborators. These can be anyone from, for experts, regulators, service users, volunteers, staff side, carers, etc. That group will be in your team to some extent or another. We'll talk about the governance in a bit, but realistically you want to be meeting with your group, this group, as an operational group regularly, possibly weekly, possibly fortnightly, and you'll be wanting a monthly to quarterly workforce meeting overall as well, which will bring in a wider group of things. So, what are the roles of this group? Well, that's where it gets really exciting and where we move into blue bubbles rather than blue boxes. On the original document, they were the dark blue circles that went around the outside. This document sort of summarises what it is your roles might be. And in reality, there are 8 roles that we've got here, with some sub-bubbles in terms of different ways that you might want to do those things. And we're going to go through these one by one, so and that forms the heart of this course. So the first thing is you want to build the workforce strategy. Now, we talked about workforce plan, workforce strategy development in course D, and that gives you the approach through. What you want to provide is an overview of the workforce, an overview of the challenge, an overview of the main projects that we're working on, and an overview of the vision for the future. So I'm defining the strategy here as I sort of did in the last course as a large, not large, it'll be a short document, but an overall view of what the strategy is for the workforce that will allow communication with people in terms of this is what we're doing and alignment. Now, I've started this course where I finished the last one with a tag to say why not get on to the GM Workforce Futures group, which you can if you're an NHS member. You can download their strategy and see it. It's quite a big strategy, it's quite a big area. But what it does very, very clearly is it sets out the main projects and the vision for the future, which it does for communication and alignment. So the first job you've got, if you're setting up a hub, I would say, is to make sure that you have built a strategy. And I say course D talks you through how you can do that, so I won't go into a lot of detail now. Now, in the last one, I talked about strategy and plan almost as if they were the same thing. But what I mean here by a plan is a detailed, evident set of interventions that are being undertaken or are planned to improve the ICS workforce. So the one before it was the big overview document that says this is what it's looking like, a big summary. This is a much more detailed set of plans, and I've split it down here into 3 different plans. One, a detailed action plan, okay, a Gantt chart, which I think I spelled right there, but might not have done. A Gantt chart that takes you through, I'm not even sure that should even be in capitals, but it might be a name, I'll have to look that up. But a Gantt chart is something which says, look, these are the different steps that we're taking in order to deliver the strategy, okay, broken down by project with some overview stuff. We'll need a detailed action plan. We should also have a detailed benefits realization plan linked to metrics, which we'll talk about in a minute, and we'll also need a detailed communications plan, okay? So this is how we're communicating with people to get this to happen. So a plan is much more detailed. It's a much more detailed evidence set of those interventions. It's not detail of the workforce, which we'll talk about in a bit. It's a detail of how we're going to go about and do it. And this will form the basis of the PMO work. What we're also going to need are projects. Okay, we are going to need some projects, and the team, the hub, is going to have to kick off, run, monitor, deliver those projects. Now, it might not be doing them all itself, as we'll talk about, because the only way to get this done, and following my we need more teeth theory, is the more people you can get helping you, the better. So you might not be doing all of it, you might just be monitoring it, etc. But you will be making sure these projects happen. And there are lots of different types of projects. So this diagram has already been seen in, I think it's in the 7Rs course. If you're interested in looking at that, it's one of the X courses. These are some example projects. These are the most of the projects that I've worked on are fitted into one of these groups. As a whole, what you've got is potentially got a set of redesign projects. So those are where you are going to be redesigning the way care is delivered and redesign the workforce within that. So typical areas are cancer, mental health, radiology, primary care, they're big ones, MSK services. Basically, your strategy should have helped you to identify which were the main ones to focus on. So there will be some redesign projects in any of these individual areas. And covering any of these specifically. So you might have one that covers population health management, you might have one that covers optimizing demand in general, or you might have a specific primary care one or specific community care or whatever. Okay. What you might also be doing is you might have addressing staff shortages in key groups. So you might be just picking those out and going, right, I need to pick on CNSs specifically, I need to pick on radiologists, I need to pick on nurses, I need to pick on GPs. These are things that I need to address with a combination of redesign and recruiting, etc. So you're focusing on that group, or it might be some general ones which are focusing around the enablers, as it were, and these are where the 7Rs come in. So you might be recruiting people, retraining people, retaining people, replacing people generally with IT, redesigning their roles, returning people to work or getting people to return to work, or re-energizing people, crowbarring in that R there to make it 7Rs. So that's where you'll be covering things like wellness, etc. So you can have a whole range of projects. I've lifted out addressing inequalities, diversity, inclusion as a separate box because that should be done in every box, but sometimes it's worth lifting it out as a separate box as well to make sure that every box is actually doing it. So Workforce Hub roles, you will be running individual projects. Now, how that goes about, how we select those projects is through the strategy. How we select people to deliver that might be through the procurement, which we'll talk about in a second. How we manage that will be through the PMO. But one of the things we will need to know is to make sure we have got a set of projects which altogether are solving the problem or addressing the opportunity. Or if they don't, at least you know where the gaps are and what you still need to fill. So projects are a key part of what we do. So as I said, one of the things you might need to do is procure that project. So not every project that we pick up will be being delivered as we speak. Not every one of those will be delivered by your team necessarily. Yes, if you've got 20 people available, you might well just do everything yourself and that will be great. But procurement even then will have an element. So any time you work in a system hub, and I've been to a fair few, there will be quite often at the people board, you'll end up with a whole host of things. People will come with ideas that have got a price tag associated with them. People will say, I need support with a price tag associated with it. And what we need to make sure we have got is we need to make sure that we have got a process for procurement that does not swamp the people board in requests, etc., and slow down what they're trying to do. And there's a whole, we need to make sure as well that we're not just getting the ideas that the people are suggesting, but that we're thinking of other things that can be done. So procurement is a key role for a workforce hub. And what might those sort of elements be? Well, the first thing is you want to make sure you are developing the market. So you need to make sure that you're aware of potential suppliers, and that suppliers, local suppliers, national suppliers, etc., are aware of our needs and what we're working on at this point. So making sure that there is a group of people that understand what we're doing and we understand what they're doing, so that we can introduce the right things into our organisations rather than the things that people are shouting about. Some of this stuff, development of the market, lists into the strategy stuff, because when we're doing the strategy, we might want to be looking at what digital tools, etc., are out there, and so this can sometimes be done alongside that. But you want to make sure you're developing the market. you do want to be recording and reporting on gaps. So you do want to be able to make sure that through the plan we're saying, we've said cancer is an important area to focus on, but we've got nobody working on it at the moment. We need to be flagging that so that we know this is where the gaps are. And we should be basically getting agreement from either from our workforce lead if they've got a budget, or from the people board if they've got the budget, or from whoever else we can get money from. We should be advertising those gaps and saying, hey, we have got a gap at the moment which needs to be addressed. I don't take the view that there isn't the money around to do this stuff. The money is there. HEE have put money in the systems. Systems are spending a huge amount of money on healthcare. That's what they do. There is always the money around. And if an area has been identified as a priority, like cancer or whatever else, we've got to find the money because it will be cost effective to solve that problem. So I don't accept that that we should be living with gaps. I think we should be finding ways of funding those gaps, and we should be advertising those gaps so people know what's going on. And we should be having a mechanism for recording who is coming back to us to say, yes, I could probably help with those gaps. Now, there's whole different ways you could do this. Advertising gaps, we could go through a proper process here of, proper procurement process, get your procurement people involved and say, right, we're going to get this out as procurement. I think realistically what we're talking about, though, is making sure that that our collaborators, our organisations, trusts, PCNs, etc., know what gaps we have. And I think we're looking for more than just external providers to come in. We might be looking at our trusts saying, I will lead this area. If you give me the funding for it, I will sort this out. If it's MSK services and there's an orthopaedic hospital within your patch, then they might say, look, give that to me and I will solve that issue, but give me the funding for a project or whatever. So we're not necessarily talking here about full-on proper procurement, but hey, I'm not a procurement expert, so get your procurement experts involved and get them to help with this stuff, so that you're going out there and following a process, be it a traditional process or a more of a collaborative process. What you should be doing is developing a set of options to say, hey, this is the problem we've got, and these are some potential ways we can solve it. And then you need a process of engagement with the people board. That process of engagement with the people board is probably about setting up a subcommittee of the people board to look at this stuff. You really don't want to be spending the whole people board talking about potential suppliers to stuff. But the people board they're accountable for the way that money's spent. It'll be their money, I'm sure, so they're going to want to be engaged. So you need to talk to the people board about how do they want to be engaged with when it comes to procurement. You also need a process, so in that particular case, you're almost certainly going to end up with a subcommittee that is then going to report to the people board. And lots of the people board, I'm sure, will get involved because money's involved, but at least you're keeping it away from the main bit of business and not filling up the people board. The other thing you don't want to fill the people board up with is a process for handling offers of help. Offers of help. So if you end up with, if you've got somebody's got a great idea, and there are millions, there are hundreds, somewhere in between those two numbers, of companies out there that have got ideas on how they can improve health and social care, you need a process for handling those offers of help. If somebody comes to you and say, I've got a great idea, I can save you billions, I can improve the outcomes by this if you get us to do stuff, and it wasn't on your original list, you can't just bat them away and say no, because they might be a great idea. You can't just say yes, obviously, because they're going to need money. And you can't swamp the people board with them because there'll be lots of them. So you need to identify a process for handling those offers of help. Typically what that will be is a regular meeting where they can present those to you as a board. As a sort of an operational group, you can run through a process of assessing those, and you can raise those possibly to the procurement sub-board, or possibly to the people board to say, this month we have had these requests and we think these are worth listening to, and maybe get one in per time to talk about it. That's what else you need. And finally, you need to manage delivery. So if you have said, a trust has said, I am going to handle this, and you've given them the money to handle it, you need to make sure they're handling it and not just randomly spending it on other things. If you've given it to a third party and the money's gone out of the health sector, you absolutely need to monitor this. So you need to make sure you are managing the delivery. But this is all about having a mechanism for procuring projects, from ICS organisations and from third parties, agreed by the People Board, managed by the Workforce Hub. And we'll talk about PMOs in a bit. Right, baselines. Baselines are exciting, and we've mentioned them quite a lot in previous things. We also mentioned that from a workforce plan point of view, or workforce strategy point of view, the plan is about holding a plan. How do you get from one to the other? But you also do need to hold a view on what one and the other is. So where are we currently, and where do we want to get to? I do know one system that is building a large repository of staffing information. It's a very big system, and even then it may struggle to do this because it's quite a big job. But finding some mechanism for holding a lot of your staff, or holding your staff information, can have lots of benefits. The main reason why you need to do this is, of course, because you've got NHSI, NHS Digital, anyone centrally, Department of Health, or whatever else, the regions, will be constantly sending you requests for information. There'll be operational planning rounds, there will be requests for ad hoc bits of information, how many nurses have you got, etc. Government will be interested in them. We can only just think, even the recent COVID stuff, how much work it was to report the COVID stats back. It's a lot of work, so you need some sort of mechanism. There is a voracious appetite for this stuff. So you can either hold it in a repository, or the one that I prefer is that you can have a bit of a route for collection, so that when you get these requests, you know where you're going to get this data from, you know who to go to, you've agreed with them that you're going to go to them, you've agreed how long it will take them to respond, you'll check that they're responding within time, and you'll follow up if they don't, and you'll have a plan for countermeasures should the information not be provided, so that you can quickly and seamlessly provide a route to collect data very quickly. So if the region asks for something, it comes to you, you fire off the request to various people, you suck that information back and you report it up to the region, and that's done very, very quickly. Somewhere in between is even better. So if you were to do those requests, but hold those requests centrally, and when somebody comes to you from the centre going, I need to know how many nurses you've got, whatever, you can go, I've got this figure here which we collected only 3 months ago, is that okay? And trying to sort of knock a few things away, so that you reduce the amount of work for people further down the line. You do need to have some sort of approach to dealing with the stuff that comes from the centre. I mean, one of the approaches could be a particularly pushbacky workforce lead who can push back on this stuff and make sure we don't get it. But having some sort of system is going to be important for you as a hub. One of the things you can use is WRaPT for this, by the way. So WRaPT is a tool which allows you to hold your activity and your current information, your future information. It would be a hell of a project to implement WRaPT across an entire ICS to be used at team level, to build a bottom-up picture at all times. I believe that sort of thing is the future of health and social care, but it is such a big project to do, and teams are not currently doing it, that it'll be difficult. But if you look at course E, WRaPT Frontline, we'll talk a little bit about how that might work. The boxes here rather pleasingly turn a slightly different shade of blue to break up the monotony, and we have here the capacity. Now, we need more teeth. I talk about this quite a lot. You need lots and lots of people helping out where you can. Also, right back in course 0, or whatever it was, A, I think it was, we had a view on workforce planning being impossible. And one of the reasons why it was impossible is we do not have lots of people who can deliver projects. And that's because we don't have many people trained in it. We used to have people in acute trust that were trained in this, but those skills have atrophied while we've been dealing with RTTs for the last 4 or 5 years or longer. We have obviously shut down PCTs, and they had people that could do this. Regional teams are getting set up. There are people out there that can do workforce planning, but there aren't enough of them. So what you need to be able to do is to make sure that as a Workforce Hub and working with your HEE colleagues as part of this Workforce Hub, you're developing and maintaining a set of available resources that you can use, and that should include HEE Star as a mechanism to work out what you should be focusing on. It should include WRaPT redesign or the masterclass approach that London are using, which is based on 6-step or whatever you want to do. You should have a redesign approach. You should have a modelling approach, which could be WRaPT. You should have a redesign approach for the system, which could be Clear, for example, for clinically led one. Others as you want, it doesn't really matter, as long as you're maintaining those tools and techniques so that people can access them, even if you're just pointing them at these videos. You ought to develop skills through action learning and training, so you should be running training programs for people or giving them access to training programs, giving them the space to go through videos like this or whatever, but you do need to make sure you are actively trying to develop skills, and the best way to do that is through action learning and through a project, as we talked about at the start. You need to bring capacity yourself, so people, even though they want their teams to be developed through running a project, will sometimes just want you to come in and sort it out yourself. They just need the help. So your team really should include some mechanism for delivering projects in the short term. Even if that help is just in getting things started, it can be a help, but technically some capacity to help with some key areas will be important. And you also need to be able to procure, as we talked about. You need to be able to bring in capacity. Now that can include engaging other people from other trusts, so engaging people who already know how to do this stuff from trusts. It might mean bringing in stuff that's already paid for. So Training Hubs has got some funding for this stuff. HEE at the moment are funding Clear use. They often provide free STAR training, etc. So bringing capacity from those ones that are already paid for. Or you can pay for other people to come in and deliver these things themselves. That means just paying people to bring capacity or paying people to do the training and development, but whatever it is, just bringing people in to actually do some of this stuff. This whole point here is, if you don't have people, you don't have investment, you don't have teeth, you can't achieve as much. Okay, so you as a hub want to bring in the capacity. Now all that stuff has been lovely, all right? And this is a particularly beautiful slide. I very much like it. This is all about engagement. Now, all the other stuff we've talked about, fairly mechanistic, great stuff. We brought in the capacity, we have a plan, we have a baseline, yada, yada, yada. Where this will rise and fall as a collaborative is on engagement. And there's lots of different viewpoints we can talk about engagement from. So when we're involving people in stuff, we need to think about these groups. The first group we need to think about is this lot here, which are the stakeholders, staff, service users, all right, key ones there. And as part of that, volunteers, carers, and staff side, okay? They're the people that are involved in workforce, okay? They're involved in the demand, okay? They're involved in the capacity and the supply of it. They're the people that will be affected by changes that happen. And so you've got to engage them. You need to find a way of engaging any of these groups with a broad viewpoint. You can't have them just being essentially the professional patient type stuff we often see, or even the professional staff member. You need to make sure that we're finding a representative group. But if you're going to work in a hub, you need to make sure you are engaging with staff side. Absolutely. You need to make sure you are engaging with service user groups, possibly through something like Health Watch. I work with Health Watch in Sheffield. They were bloody marvellous. I'd work with them every time from now on. You do need to engage with those, okay? But they're the real groups to make sure you're engaging with. You also need to engage with the population, okay? Because the changes you are making at ICS level could be quite significant, okay? If you are shutting an A&E, all right, then obviously you will end up with issues, and you always do. If you are moving services from one place to another, you will end up with issues. In reality, you will end up with issues no matter what you do, because people are people. But the more you engage people, with a positive vision, which isn't you are losing something, but you will be gaining this which will result in this change, the more support you are going to get, and the more likely you're going to be able to implement your changes. You might think, well, that's got to do with staff. Well, the reality as to why we shut or open A&Es is often down to staff issues. The same with why you're moving services. So it is important that you engage the population through this. You may be doing it with a wider group, but you are going to need to engage with those. You're also going to need to engage with what we're calling here arm's length bodies. So you are only going to succeed in your hub if you engage with NHS I&E. They have got experts, they've got good practice, they've got money, they're linked to the centre. Yeah, NHS I&E, absolutely vital to engage in your workforce hub. They've got transformation experts. They've got their own approaches to transformation, which you can use as part of it. You want to engage with them with your workforce change, even if they're doing transformation. I mean, talk about an organisation with teeth. That is one. All right, so you want to be engaging with those. Another organisation with a lot of teeth is Health Education England. These are the people that will have information on training numbers and what's coming through. They will have access to tools and techniques. They too have access to funding. They are the experts in workforce redesign. They have training courses. They can point you to those. They are very, very good people in all sorts of aspects, including digital, workforce planning training, workforce planning in itself, workforce transformation approaches. Okay, you are going to want to engage with HEE, and you're going to want to engage with NHS I&E. And there's a whole range of others as well that fit in that group. Local academic health science networks, AHSNs, you really should be engaging with them. Skills for care, skills for health. Skills for care, really helpful in terms of providing information on what's going on in social care, which is often an area which we don't involve enough. The leadership academies, any of these ones. It might be a local think tank. In Manchester, we work with New Economy. Local think tanks, etc. can be really, really helpful to engage. And then finally, organisations. Okay, now, if you are an ICS with multiple ICPs, multiple places, engaging with organisations is interesting, because you've got you may well just want to engage with ICPs and they engage with organisations, right? But the trouble is you've got certain system level organisations which won't think in ICP footprints. So your local mental health trust and care trust, for example, will probably operate across your entire or large parts of your ICS. Your ambulance trust almost certainly will operate across your entire ICS, and possibly another one as well, one or two. So they might not want to engage at ICP level. So you will need to be able to engage your organisations. Why? Well, they need to know what's going on. They are the actual deliverers of health at the moment, health and social care. So in organisations, we need to think about councils and local authorities, many different types of councils. You will need to be able to find a way to engage with these. That will include care homes, tertiary care providers, community care providers, mental health providers. It's a whole host, and private providers. They'll be represented in the various bits of government, but they do need to be engaged with. So that's the group. Now what we need is a mechanism to meet with stakeholders and collaborators regularly. And that is where the 3 rings come in. So you want to engage and you want to meet with those people. You need a bit of a model for it. And what I like the 3 rings for that, because it helps you to think about how much do you want to be engaged. And it's kind of like with great power comes great responsibility if you're a Spider-Man fan. And it's the same with this. If you want to be in the inner circle, you will get influence, but you will have to put more effort in. Okay? If you're on the outer circle, you'll have less influence, but you won't have to put very much effort in at all. So the inner circle, if you want to be on the inner circle, you might meet monthly, you might be engaged in procurement processes, you might be involved in prioritization, your expertise will be used to help manage the agenda, you'll hear firsthand what comes out of the people board, and you'll be able to get involved in sorting that out and addressing it. That inner circle is going to be involved in those conversations. So Quite often, HEE are involved. Well, almost always HEE are involved in that. Sometimes NHSI and E should be involved in that. Okay, there'll probably be very few other organisations will be involved in that inner circle. As a WRaPT team, we have been involved in that inner circle in a couple of systems because we're willing to put the effort in, but we're also willing to take the benefits of being first on the scene to hear about that stuff and therefore being involved right from the start. So that inner circle is a real operational group. The middle circle might meet quarterly as part of a formal engagement and discussion group, okay, and more organisations will fit there. And then the outer circle will be involved, say, annually as part of a large-scale workshop where you're highlighting progress and you're discussing various topics in groups. So they're hearing a bit about it and you're getting a bit of an input from them, but it's much less. Now, engagement is an interesting one to think about in terms of, do you think about it in terms of ICS or ICP level? So if you've got multiple ICPs and you're a big ICS with 5 ICPs, then do you want that engagement to happen at ICP level, or do you want that engagement to happen at ICS level? And that will be a challenge that you'll have to face. The reality is that organisations will probably want to engage at ICP level, which is great, and so you won't see them at ICS level, but certain big organisations like the Ambulance Trust might want to operate at ICS level, and other organisations will just want to engage once rather than engage with lots of individual ICPs. There's no answer to that. It's just something you need to think about and understand about it. Now, engagement will be for 2 reasons. It'll be for specific purposes, things that you need to happen and it need to get done, but it will also be as part of the communications plan. So you might want to get things done from that group, but you might just want to communicate with that group. And so you need that mechanism to meet with those stakeholders and collaborators regularly. At the end of this, what you'll have is you'll have a complete list of people you want to engage. You'll have a proper communications plan. You'll understand what parts of the process they're in, inner, middle, outer. And you'll have a mechanism to say, right, we are going to have a monthly meeting for the inner circle, a quarterly meeting for the middle circle, and an annual meeting for the outer circle. And those are all things that will need to be arranged, which is why you need an administrator. Cool. So then, on to the exciting world of governance. What you need is a link from the SRO and the SDP leadership to raise issues, understand the requirements, etc. You need to be linked in with what's going on because you can't do workforce on its own, as I think we mentioned a number of times in various other courses. So what are you going to need? We've talked a bit about this under the team, but the governance of itself is absolutely critical. Well, of course, everything's critical when it comes to workforce. You are going to need your executive lead for workforce. Now, that lead will be accountable for the development and delivery of the workforce agenda. That should have been set up anyway as part of the overall system governance, so should be a given. And as I said before, they should report into and be part of the wider system governance. Okay, they need a mechanism to deliver that agenda, and that is the workforce collaborative off to the right, which is what we've been talking about, a hub or collaborative. Brilliant. Okay. So you've got your executive lead, you've got a workforce lead, a PMO lead, an administrator. They may or may not be part of the people board, or they might just work as a collaborative off to the side. You're also going to need to make sure that in the people board you've got ICP or organisation representatives. What I mean by or is that you might need just one. If you've got 5 ICPs, you might just have the lead for those and they need to represent all their organisations, or you might, if you're just a single, if this is an ICP or you're a single ICP, ICS, then you may have organisation representatives. You may have a mix of both. You're going to need some specialist representatives. Okay, so those will be those organisations that that might be for topics that you want covered. So primary care, for example, you might want those in there. You might want digital representatives in there. You might want any of those specialist groups that you want to engage. You might need subcommittee representatives, certainly the procurement subcommittee or any others, and you might have other stakeholders in there as well. Those other stakeholders could be staff side, could be patient groups, for example. You may or may not want them engaged at that point. I always think it's good to engage them there though, because as long as you've got the right ones there that aren't going to go running off and they see themselves as part of the team rather than just there to look at stuff, it is important that you have them engaged. Then there will be links with ICP workforce groups, ICP system boards, etc. There are some great governance people out there that can set this stuff up, but you do have to be careful with the flow of papers. If you've got a system board that meets monthly, this people board meets monthly, and then you've got ICP workforce groups meeting monthly, and then possibly even organisation workforce groups within those ICP workforce groups. You can get to the point where in order to get papers to a system board, you need to have have had meetings. You're working about 3 months behind in your organisation workforce groups because of the way that papers flow. So you've got to be a bit careful with governance to set it up right from the start. Governance is not the be-all and end-all, but getting a simple, quick bit of governance so you know how things are sorting out, making sure they all get their terms of reference and all that good stuff is absolutely critical to getting a workforce hub working. And then I think it is finally my favourite bit of a workforce hub is what we call the Program Management Office, or PMO. It's a mechanism to monitor progress against plan, and it is so much more. A PMO done well, and I have seen it done very well. Riona in Manchester is a joy to watch. And it is the thing that means that everyone can keep their hair for a little bit longer if you've got one in place. What a PMO does is, at its heart, is it understands the job that needs to be done and by when, as a starting point. Okay, so it's the group that can tell you of all the requests that we've had. It's the one that holds the ring and says, right, this was our strategy. These are all the things that needed doing. This is the stuff that's come in since. This is a complete list of all the things that need doing and by when, so that nothing is blindsiding us. We knew about it well in advance. Whether we did something about it or not is entirely up to us, but at least we knew about it in advance. They document all the things that are being done to address the need. Okay, so they're the ones that know everything that is being done to address the job that needs to be done. Okay, so they're making sure we've got all that, and they are highlighting variances between what needs to be done and what is being done. Okay, so they're highlighting variances between the actions, between the vision and the actions that are being taken to deliver that vision, or designed to meet that vision. They can certainly say, hang on a minute, it's not even designed right, and they can say where we're not doing stuff to actually meet those actions. They can identify the metrics and manage the metrics and produce the metrics that need. Those metrics need to be monitored to evidence that actions are actually having an impact. So PMO can actually make sure that even though we're doing all the actions, it's being done, and they're measuring progress against those actions. So they're the ones saying these were the actions, and we are on or more likely off track for these reasons. And they provide various reports to the people board, and they provide reports to the group so that we know where we are. They will often manage the governments to make sure that all the meetings are happening as they should be happening. They'll manage the procurement process and the subcommittees, and they will be the ones that potentially organise the engagement events with the administrator doing the actual organising. But they'll be the ones that set up those various different engagement events, the annual one, the quarterly one. This group, they are not administrators. They are a program management office. They are at the heart of any hub, making sure it happens. I say whether it's a part-time person, a person, or a small team. Always recommend a small team if you can. This is an absolute critical role for a hub. So I've been through those. So what have I been through? Well, I've been through the 3 rings. Okay, in this case, we've got in the middle of it, we've got our team. So obviously we're doing stuff all the time. Then we've got the ring with our closest collaborators in it, and then we've got the medium and then the outer rings with fewer stakeholders in each one. We've talked about the team. We've talked about the need for an executive lead, a workforce lead, and a team of PMO doers and administrators to actually get on with this stuff. We've talked about the fact that we will have ICP reps and close collaborators working with us as a key part of that, and they're the ones that should be regularly meeting every month to move things on. And moving things on is done in a number of areas. It means having a strategy, and a plan, a detailed plan of action. It means making sure we understand the projects that we're delivering, a process for procurement, a process for having a proper baseline and a flow of information on current and future states, and the detailed staff numbers that we always need. Absolutely critical part of engagement. We've talked about the governance, and finally we've talked about the PMO doing all this stuff. So I could leave it there and say that's what a workforce hub or collaborative is. And indeed, these are being developed all over the place. I helped set up Manchester. I was involved in the setup of Manchester along with lots of other people. I've also been involved in other areas as well doing this. But other people have picked up on this being important, and one of them is NHS-I and E, who have developed with, I think, Ernst & Young, the approach called SWIM. Now, I've seen SWIM, I've seen the various diagrams, but I don't know to what extent they are available to be shown to everybody and the like. So as soon as it is launched, if it is launched, which I hope it will be, I'll do a session on SWIM with the proper diagrams in it. But they are talking about the following bits being important, and they did base it on 10 systems around the country, one of which was Manchester, which, as I say, I was involved in. And I do like SWIM. What I've seen of it, and I haven't seen a lot of it, but what I have seen of it, I do like. So it will be well worth grabbing hold of a copy if you get involved in any of these roles. What does it include? It includes talking about governance. It includes a need to prioritise your workforce challenges, which your strategy will do. It talks about external relationships and the need to include those, which the 3 rings does here. It talks about the need for resources to be able to deliver this stuff. It talks about the fact that you need an SRO and a workforce team, and it does absolutely put front and foremost the fact that staff side should be part of delivery. So there is quite a lot of stuff in SWIM which will be worth looking at. So if you do get involved in any of these roles, then get hold of SWIM as a model, because it is something which does help understand where NHS-IE think you should be, and that's never a bad thing to know what your stakeholders think you should do. But there's some good stuff in there as well, so please look at it. Don't see it as a model you've got to follow, and it's actually worth looking at. It's not a chore, it is development. So that's my pitch for SWIM there. So that's it, a 1 course. I don't know how long that's gone on for, but probably I bet it's a while. But that is just it, a 1 session course. As I say, have a look at session X6 on metrics when you get the chance. But you might want to look at the WRaPT redesign course, you might want to look at the WRaPT plan course, and you might even want to look at the WRaPT frontline course, which is not on the system yet, but will be very soon. You will almost certainly want to buy the bumper book of Health and Care Workforce Planning if you want more cutting edge workforce planning advice. You'll be glad to hear there are very few diagrams in there, so there's not a lot of blue boxes to look at or circles. But the bumper book of Healthcare Workforce Planning will be available on Amazon in July. You should register to the WRaPT tool if you haven't already done so. Please feel free to do that. You'll get a login if you log in through there, and you can visit various other places for resources: the Carados website, the WRaPT website, and the Health Education England workforce planning pages. They're all available, and I think other than trying to get a hold of a copy of SWIM from any other colleagues or from your NHS-IE team, I think that will just about do you, I think. So that's it. Thanks all for listening. Look forward to speaking to you all on perhaps the WRaPT frontline course. Cheers.